Hi, I'm Alisha from adultspeechtherapy.co, and today I'll be talking about functional memory activities for dementia. With dementia treatment and interventions, remember, we want to keep them meaningful and functional. So to do this, oftentimes you want to interview the patient, but with their caregivers to learn their preferences, their daily routine, and their history. We want to take advantage of the patient's strengths and skills. So with dementia, this may include reading, procedural memory, and motor learning. If you do happen to know the specific type of dementia, that can be more helpful when choosing treatment goals and interventions. So for example, if a patient has Lewy body dementia, they may have more sleep and motor disturbances. So you may think about, okay, I'm going to put emphasis on their schedule. That's important for them. While a patient with frontotemporal dementia may have more primary progressive aphasia, and you may want to work on language goals. So again, we're keeping it functional, and a lot of our goals with dementia will work on safety, such as safe swallowing tips, using a call light, asking for help, locking a wheelchair or walker brakes, daily activities, checking their daily schedule, finding the bathroom, oral care, finding answers to repetitive questions. So those are just some of the ideas for goals, and what I like to do is oftentimes create a memory book and work with them with that, looking at photo albums and labeling them for them. You can even do simple sorting items such as laundry or beads and having them follow directions, and reminiscence therapy during it. Again, remember, keeping our therapy worked on functional safety for patients with dementia. For everything else, including free PDFs, check out adultspeechtherapy.co.